Welcome to our deep dive today. We're going to be exploring the history and nuances of psychologists prescribing medication. It's been a hot topic in the mental health world for a while now.
Absolutely.
And you've sent over some really interesting research and expert opinions from CSPP,
Yes.
the California School of Professional Psychology at Alliant International University.
Right.
So we're going to unpack all of that and get everyone up to speed. We're going to kind of tackle this like a guided tour today.
Okay.
I'll point out the most intriguing parts of what you shared.
Right.
And you can help us connect the dots and understand the bigger picture.
Sounds good.
So think of it as a crash course in clinical psychopharmacology.
Okay. Great.
So I think it's helpful to start with the why. Why are we even talking about psychologists prescribing medication? What's driving this whole movement?
Well, that's a great question, and one that's often overlooked. You see, the push for psychologists to have prescriptive authority, that's the official term,
Okay.
stems from a very real problem: the growing need for mental health services, particularly in underserved areas.
I see.
So think about it. We hear all the time about long wait lists to see therapists or the shortage of psychiatrists, especially in rural communities.
Yeah.
This movement is all about trying to find ways to bridge those gaps, make mental health care more accessible.
That makes sense. And it seems like CSPP is playing a key role in this movement.
They are.
They were actually the first in the U.S. to offer a Master of Science in Clinical Psychopharmacology program,
That's right.
even before the APA had established guidelines for such programs. That's pretty forward thinking.
It is. And what's even more interesting is that the initial push for this program at CSPP came directly from practicing psychologists in Louisiana. They were already working on legislation to allow prescribing in their state.
Wow.
And realized there was a need for specialized training.
Interesting.
So they reached out to CSPP, and the rest, as they say, is history. It really highlights the dedication of these early advocates. They saw a problem and proactively sought a solution.
They were ahead of the curve.
Yes.
Okay, so now we've got some context. Let's dive into the heart of the matter. The arguments for and against psychologists prescribing medication. I imagine there are strong opinions on both sides.
There definitely are. On the one hand, the potential benefits seem pretty clear. Increased access to care, especially in those underserved regions we talked about, is a major plus. It also potentially leads to more streamlined care coordination.
Okay.
Imagine being able to address both your therapy needs and medication management with the same provider.
Right.
That could mean fewer appointments, streamlined communication, and a more integrated approach to your care.
That makes a lot of sense, especially for someone who might be struggling to navigate a fragmented healthcare system.
Right.
But what about the concerns?
Yeah.
You mentioned strong opinions.
Yes.
I'm guessing not everyone is thrilled about this idea.
Right. And probably the most common concern you hear is about safety. People wonder if psychologists, with their training focused on therapy and not traditional medical school, are truly equipped to prescribe medication safely.
Right.
It's a valid concern.
Yeah.
And one that needs to be taken seriously.
So how do we know if prescribing psychologists are actually practicing safely? Is there any research to back this up?
There is.
Okay.
And it's quite reassuring.
Okay.
Studies have compared the prescribing practices of psychologists to those of psychiatrists, and the results have been very consistent. They've found that prescribing psychologists actually demonstrate comparable safety records to psychiatrists. They tend to be more conservative with dosages and the number of medications prescribed, which really puts a lot of those initial concerns to rest.
That's good to hear. So it's not just about the length of training, but the specific focus and expertise that these programs provide.
And on top of that, many states with prescriptive authority have implemented very rigorous protocols and oversight to ensure patient safety.
Okay, so tell me more about these safety measures. What kind of hoops do psychologists have to jump through to get prescribing privileges?
Well, let's take New Mexico, for example. They were one of the early adopters of prescriptive authority for psychologists. To get licensed there, you first need to earn your Master of Science in Clinical Psychopharmacology, or MSCP, which is a specialized degree focusing on the safe and effective use of medications for mental health conditions.
So that's the foundation. But I imagine there's more to it than just getting the degree.
After earning the MSCP, there's a period of practical training under the supervision of a licensed prescriber, typically a physician. This hands-on experience ensures that psychologists are applying their knowledge in real-world settings and receiving expert guidance.
That makes sense.
Yeah.
It's like a residency for psychopharmacology.
Exactly.
But what happens after after the supervised training?
There's also a rigorous licensing exam specifically focused on psychopharmacology. This exam ensures that psychologists have a thorough understanding of the medications they'll be prescribing, including potential side effects, interactions,
Right.
and appropriate dosages. Only after passing this exam can they apply for a provisional prescribing license.
So even with the degree, the supervised training, and passing the exam,
Yeah,
they're still not fully licensed to prescribe.
you got it.
Wow.
In New Mexico, even with the provisional license, there's a 2-year period of supervised practice
Right.
before they can apply for an unrestricted license. This continued oversight helps ensure that psychologists are prescribing responsibly and safely during those first few years of independent practice.
Wow, that is incredibly thorough. It seems like they've really thought of everything to protect patients.
And even after they obtain that unrestricted license, there are still ongoing requirements for continuing education and regular reviews of their prescribing practices. This ensures that psychologists stay up to date on the latest research and maintain high standards of care throughout their careers.
All right, so we've covered the driving forces behind this movement and the arguments for and against psychologists prescribing medication.
Right.
We've also seen how rigorous the training and safety protocols are. Now I want to learn more about CSPP's unique approach to training prescribing psychologists.
Okay.
You mentioned they were pioneers in this field. So what sets their program apart?
Well, as we discussed, they were the first in the U.S. to launch an MSCP program, and they've continued to innovate ever since. One of the things that makes their program stand out is that it's entirely online.
Online learning for something as complex as psychopharmacology.
I know.
That's interesting. Can you really get the same quality of education online?
Well, that's a fair question.
Yeah.
A lot of people have that initial reaction, but what CSPP has done is create a very unique online learning experience that combines the flexibility of online learning with the engagement of a traditional classroom setting.
So it's not just watching videos in your pajamas?
Not quite.
Okay.
2/3 of the program involves live interaction with faculty and other students through video conferencing. This allows for real-time discussions, case presentations, and the opportunity to apply learning to real patient scenarios. It's as close to a traditional classroom setting as you can get online.
That makes a lot of sense. I can see how that kind of interactive learning would be crucial for a topic like this. It's not just about memorizing facts. It's about applying knowledge and critical thinking. And another thing that sets CSPP apart is that they're one of only 2 programs in the country that accept students at the doctoral level. This means that candidates can earn their MSCP concurrently with their doctoral degree.
Talk about efficiency.
Yes.
It sounds like they've really thought about how to make this training accessible and engaging for busy professionals.
Right.
Okay, so we've covered their online format and their focus on doctoral students. Is there anything else that makes CSPP stand out?
Yes. One more thing. CSPP's commitment to this movement goes beyond just offering the program. They're actively involved in advocating for legislative changes to expand prescriptive authority for psychologists.
Dr. Alan Lincoln, a former MSCP program director at CSPP, is playing a key role in pushing for prescriptive authority in California. He's about to become the Psychopharmacology Division president within the California Psychological Association and will be in a great position to advocate for this change.
Now that's impressive.
Yeah.
It's one thing to train prescribers, but it's another to actively fight for their right to practice.
Absolutely.
It speaks to their dedication to improving mental health care access and recognizing the valuable role psychologists can play.
For those of you in California, this is especially pertinent because, as we mentioned, legislation is in the works that could change the landscape of mental health care in your state.
So it sounds like obtaining an MSCP from a reputable program like CSPP could be a strategic move for any California psychologists who are interested in potentially prescribing in the future.
It certainly could. And for those of you who are Alliant alumni, CSPP offers a tuition discount,
Okay.
making their MSCP program even more accessible.
Now let's meet some of the expert faculty
Right.
who are shaping the next generation of prescribing psychologists at CSPP. Who are some of the key players you came across in your research?
Well, you can't talk about CSPP's MSCP program without mentioning Dr. George Kapulka. He's a seasoned clinical psychologist with over 20 years of experience running a private practice focused on children and adolescents. What's really fascinating is that His work highlights the potential for prescribing psychologists to address the needs of young people, a population that often faces barriers to mental health care.
Right.
He's also board certified in both clinical psychology and psychopharmacology. And he's a huge advocate for better collaboration between medical and mental health professionals. He really embodies the spirit of this movement.
He sounds incredible.
He is.
Who else is shaping the program?
Another powerhouse in the field is Dr. Judith Steinman, a past president of APA Division 55, which focuses specifically on psychopharmacology and pharmacotherapy. She was also a former director of the CSPP MSCP program, so her expertise is invaluable.
Yeah.
She's really passionate about standardizing training and advocating for high ethical standards in psychopharmacology practice.
It sounds like she brings a wealth of knowledge and leadership to the program.
She does.
Anyone else we should know about?
Dr. Alan Lincoln, former MSCP program director, has been at Alliant since 1978.
His longevity highlights the depth of experience within CSPP.
It does.
And he actually continues to educate students today as a distinguished professor. To recap what we've explored so far, we've looked at the reasons behind the prescriptive authority movement,
Right.
the potential benefits and the concerns people have,
Right.
and the rigorous training and safety protocols. We've also delved into CSPP's pioneering role in this movement,
Yes.
highlighting their unique online program and their dedication to advocacy.
Great overview.
As we've been unpacking this topic,
Yeah.
it's become clear that it's not just about the science of medication. It raises important questions about ethics and the way we deliver mental health care. And one of the most crucial ethical considerations is ensuring that psychologists with prescribing privileges maintain clear boundaries between their roles as therapists and prescribers. So it's about making sure those lines don't get blurred.
Exactly. That sounds tricky.
Yeah.
Can you give me an example of how that might play out in a real-life scenario?
Sure. Imagine you're seeing a psychologist for therapy.
Okay.
And during a session, you mentioned struggling with anxiety. If your psychologist also has prescribing privileges, it's essential that they carefully explain the options available to you.
Right.
They might discuss both therapeutic approaches and medication as potential paths, but they need to make it clear that the choice is ultimately yours. You should never feel pressured to take medication just because it's convenient for your therapist
Right.
or because they think it's the only solution. Feeling pressured could really damage the trust and rapport you have with your therapist.
Exactly.
Yeah.
And that's why informed consent is so important. Ethical guidelines emphasize that patients need to fully understand the risks and benefits of medication, as well as alternative treatment options before making any decisions.
It's about empowering patients to make informed choices about their own mental health care.
Absolutely. Now, shifting gears a bit, let's talk about the potential impact of this movement on the delivery of mental health services, particularly in those underserved areas we've been discussing. What do you think might change if more psychologists had the ability to prescribe?
Well, it seems like one of the most obvious benefits would be reduced wait times. If you have more providers who can prescribe medication,
Yes.
it could potentially alleviate some of the backlog and allow people to access treatment sooner. What do you think?
I agree.
Yeah.
Shorter wait times could be a game changer,
Yeah.
especially for people in rural communities or those who have limited access to psychiatrists. And there's another potential benefit to consider: improved care coordination.
Right. We touched on that earlier.
Yes.
It seems like having one provider who can address both the psychological and pharmacological aspects of treatment would streamline things significantly. No more running around to different appointments
Right.
and trying to keep track of who said what.
Exactly.
Yeah.
It could create a much more holistic and patient-centered approach to care. It's about treating the whole person, not just their symptoms.
Okay, so we've talked about some potential benefits, but let's be realistic. Integrating prescribing psychologists into existing healthcare systems is probably going to come with its fair share of challenges.
It won't be a seamless transition.
Right.
There will likely be logistical hurdles to overcome.
Yeah.
Like insurance coverage and billing procedures. For example, will insurance companies cover medication management provided by psychologists in the same way they cover it for psychiatrists? Those are the kinds of details that need to be worked out.
And I imagine there might be some pushback from other professional groups like psychiatrists who might see this as encroaching on their territory. Have you seen any evidence of that?
Yes, that's definitely a concern. Some psychiatrists feel that psychologists don't have the necessary medical training to prescribe safely, even with the specialized programs.
Yeah.
It's important to acknowledge those concerns
Right.
and foster open dialogue between the different professional groups.
Everyone's goal should be the same, improving patient care and outcomes.
Thinking about the bigger picture, where do you see this field heading in the future? It seems like it's constantly evolving.
For one thing, I think research is going to play a huge role.
It will.
As more data becomes available on the long-term impact of prescribing psychologists, we'll be able to make more informed decisions about training, regulation, and best practices.
Yes.
It's almost like a giant experiment playing out in real time.
That's a great way to put it. And I think CSPP, with their pioneering spirit and commitment to this movement, will undoubtedly continue to be at the forefront of this evolution. They're not just training prescribers.
Right.
They're actively engaged in research and advocacy, shaping the future of the field.
Speaking of CSPP,
Yeah.
I think it's important to view this program as an investment in your future career. If you're a psychologist in California, obtaining this degree could open doors to new opportunities. As the landscape of mental health care continues to evolve, it's about positioning yourself for success in a rapidly changing field.
It's a really good point. Okay, so we've discussed the ethical considerations,
Yes.
the potential impact on patient care, and the future of this field.
Right?
What do you think is the most important takeaway for our listeners? What do you hope they walk away with?
More than anything, I hope this deep dive has highlighted the complexities of this issue. It's not as simple as psychologists wanting to prescribe medication. It's about increasing access to care, improving patient outcomes, and recognizing the expertise that psychologists bring to the table.
It's about seeing mental health care as a multifaceted puzzle, and this movement is just one piece of that. And if this conversation has sparked your interest, I encourage you to delve deeper, do your own research,
Okay.
and stay informed about the ongoing developments in this field.
Knowledge is power, right?
Absolutely.
The more we understand, the better equipped we are to make informed decisions about our own health care and advocate for better mental health services in our communities.
Now, before we wrap up, I'd like to leave you with something to ponder, given the increasing demand for mental health services and the logistical challenges of integrating prescribing psychologists into existing systems. What other innovative approaches could we explore to bridge the gap in care?
That's a great question.
Yeah.
It's like a challenge to think outside the box and imagine new possibilities. What are your thoughts?
Well, one idea that's gaining traction is the concept of integrated care teams. This involves bringing together different healthcare professionals,
Yeah.
including psychologists, psychiatrists, nurses, social workers, and primary care physicians to collaborate on patient care.
So it's about breaking down those silos between different disciplines and creating a more seamless experience for the patient.
Exactly.
I like it.
Yeah.
Okay.
And another approach that's showing promise is the use of technology to increase access to care. We've already talked about CSPP's online MSCP program, but there are other exciting developments in telehealth, mobile apps, and online therapy platforms.
Right.
These tools have the potential to reach people who might not otherwise have access to traditional mental health services.
It's amazing to think about the possibilities.
It is.
It feels like we're on the cusp of a real transformation in mental health care.
I agree.
Yeah.
And as we move forward, it will be crucial to stay informed, engage in thoughtful dialogue, and advocate for innovative solutions that prioritize patient well-being.
We've covered a lot of ground,
We have.
exploring the history, the training, the benefits,
Yeah.
the concerns,
Right.
and even what the future might hold.
It's been quite a journey.
Yeah.
And I think it's important to acknowledge that even within the field of psychology, there are differing opinions on this topic.
Great.
You know, it's not like every psychologist is wholeheartedly on board with prescriptive authority. Some psychologists see it as a natural extension of their training and expertise, believing it allows them to provide more comprehensive and integrated care to their patients. Others, however, have reservations.
What are some of the things that make psychologists hesitant about prescribing?
Well, some worry about the potential for blurring the lines between therapy and medication management.
I see.
They want to ensure that the therapeutic relationship remains focused on the patient's emotional and psychological well-being, without the added complexity of prescribing decisions.
It's about making sure the focus stays on the patient's needs and goals, not just managing symptoms with medication. And some psychologists simply feel that their training, while extensive, doesn't fully equip them to handle the complexities of prescribing.
That's right.
They recognize the importance of in-depth medical knowledge and experience,
Right.
and they don't want to take on a responsibility they feel ill-prepared for. It's about knowing your limits and practicing within your scope of competence. So it sounds like this isn't a one-size-fits-all issue.
It isn't.
There's a lot of nuance and individual perspectives to consider. Each psychologist has to weigh the pros and cons, consider their own training and experience, and decide what feels right for them and their practice. As with any field, new research emerges,
Right.
guidelines are updated,
Mm-hmm.
and perspectives shift.
Yes.
It's a continuous learning process. So where do we go from here? What are the key takeaways?
First and foremost, I hope this deep dive has helped to demystify the topic of psychologists prescribing medication. It's often portrayed in a very simplistic or even sensationalized way, and I think we've shown that it's a much more nuanced issue than that.
Yeah, it's about so much more than just handing out pills.
Right.
It's about addressing a real need for increased access to mental health care and exploring innovative ways to improve patient outcomes.
Exactly.
And I hope listeners have gained a deeper understanding of the rigorous training and safety protocols involved, as well as the ethical considerations that guide prescribing psychologists.
Absolutely.
We've really tried to paint a comprehensive picture of this movement, motivations behind it,
Right.
the challenges it faces, and the potential it holds for transforming mental health care.
Absolutely.
And for those of you in California who are intrigued by this possibility, I encourage you to learn more about CSPP's MSCP program.
It's a great program.
They've been pioneers in this field,
They have.
and their commitment to excellence is evident in every aspect of their program, with their flexible online format, world-renowned faculty,
Yes.
and emphasis on real-world application. They're preparing the next generation of leaders in clinical psychopharmacology.
They are.
And who knows, maybe one day soon,
Yeah.
California will join the ranks of states where psychologists have prescriptive authority.
It's very possible.
It's definitely something to keep an eye on.
Yes.
It's an exciting time to be in this field, full of potential and possibilities. But even if you're not a psychologist, I think this deep dive has relevance for anyone who cares about mental health. The more we understand about the different approaches to mental health care, the better equipped we are to advocate for ourselves and our loved ones.
Absolutely.
Knowledge is power.
It is.
So stay curious, stay informed, and keep asking those tough questions.
Well said.
And on that note, we want to thank you for joining us on this deep dive.
Thank you.
We hope you've learned something new, gained some valuable insights, and maybe even sparked some inspiration to explore further. Remember, mental health is a journey, not a destination.
That's right.
And there are many paths to well-being. Keep exploring, keep learning,
Yeah.
and keep taking care of yourselves.
Absolutely.
Until next time, happy learning.